Medical rounds, the coronavirus has certainly had such an impact on our everyday life, to say the least. For some, the pandemic will actually have long-term consequences. Joining us now is Dr. Alvaro Menendez. He's a medical oncologist who specializes in breast oncology, and he's here to talk about health concerns coming out of this pandemic. Doctor, welcome.
Hi, how are you?
I'm good, I'm good. You know, for the greater part of the year, a lot of people have been in a state of lockdown and maybe avoiding the doctor. As an oncologist, what concerns you most about this?
So after we shut down during the COVID-19 pandemic, we were all scratching our heads thinking, how is it going to impact the patients who have a diagnosis of cancer and receiving chemotherapy? But we were mostly concerned about the patients who didn't have a diagnosis of cancer and decided not to see the doctor, not to get their screening mammograms. How is this going to impact them? And as we're starting to resume our normal activities, sometimes with complementary activities just to catch up, we're starting to see some patients come in with really more advanced types of cancer or stages of cancer.
And is this having a greater impact on underrepresented populations?
Yes, absolutely. And so that's one of my clinical interests, understanding the underrepresented populations. Historically, underrepresented populations have not wanted to go to the healthcare system for a variety of reasons. And given the fact that COVID-19 was affecting them at an exponential rate compared to their counterparts and their historic fears, we are able to see that underrepresented populations are still not coming to the healthcare system. Even now that we have the COVID vaccine, patients are refusing to get the COVID vaccine. So this is putting the underrepresented populations at a higher risk.
And doctor, just quickly, as we run out of time here, but we are seeing some problems with breast imaging results related to the vaccine. So can you talk about that briefly?
The COVID vaccine actually appears to cause an immunologic reaction causing lymph nodes. And the lymph nodes are one of the things that we see sometimes associated with breast cancer we get concerned about. So we are seeing that some patients are having mammograms with abnormal lymph nodes. To the population, I would say this should not prevent you from getting the COVID vaccine or obtaining the mammograms. What we do is if we notice those lymph nodes, a repeat imaging 3 months later, and then if everything's okay, we move forward.
Right. That is your body. That's the response you're supposed to have to the vaccine, but maybe timing with the mammogram. Thank you, Dr. Menendez. For more information, head to hartfordhealthcare.org/mammograms right there on your screen. And